Get more on that now. Dr. Thembisile Xulu is the Chief Executive Officer of the South African National AIDS Council. Ma'am, good afternoon to you, and thank you for your time tonight. So we see a marginal decrease in the number of people living with HIV, a very tiny decrease. Is it significant in any way? Does it change us that the pattern or prevalence of the virus really is changing?
Thank you, Stephen. It's significant in that what the HSRC has not shown us is incidence, which is new infections. So we are still waiting for that. So what prevalence refers to is the fact that the pool of HIV-positive people is coming down, meaning that based on the interventions for prevention, for treatment, there is no onward transmission at a high scale. Because people are on treatment and they are virally suppressed, they don't pass on the virus. And because pregnant mothers are taking treatment not only during pregnancy but also during breastfeeding, you are having a high number of HIV-negative babies actually entering into the denominator, and therefore the baseline of HIV-negative people is wider. But what this also reflects is that people that are living with HIV who are on antiretroviral therapy are actually living longer and living healthier lives. And therefore what this signifies is we are actually having a bigger base in terms of the HIV negative, in terms of the denominator, and quite a significant contribution in terms of the prevention and treatment interventions.
So the big figure obviously is the percentage of people who contract HIV, and that we don't know yet. We don't know if there's been a big change in that.
At the moment, the survey hasn't given us any data on incidence. They've mainly looked at prevalence. But from a programmatic perspective, we are concerned about incidence in young people, as was reported earlier.
People who are living with HIV, and we're told sort of scientifically that if you are on antiretroviral drugs, we know that your life will be really the same as if you did not contract HIV. Your life expectancy is the same. Actuarial tables are the same. I know that some people, though, say, yes, I'm on antiretroviral drugs, but I still have this thing inside of me. Is that still a problem? People still battle with that. And I imagine that must be quite difficult.
It's still a thing, Stephen, and it's what we referred to as self-stigma. And the only way that we are able to address that is when we get communities and people living with HIV themselves to lead interventions. So when you look at, for instance, the latest policy position that we've adopted, which says an undetectable viral load means it's untransmittable. That means when you are living with HIV and you are on treatment and your viral load is undetectable, you will not transmit HIV through sexual contact. That means you can live a happy, healthy life, live without being ill, and grow to see your grandchildren. When that message comes from your peers, and it's such positive reinforcement, just in terms of living, loving, and being happy, it does start to reduce that self-stigma. But it is still a thing until it's not myself as a decision maker, but other people living with HIV that are pushing the message.
And the communication around HIV, I mean, I remember there was a time in our society when we talked about it, unfortunately argued about it all the time. We don't talk about it nearly as much as we did. Is there not enough communication? I mean, the levels of communication around it, are we not talking about it enough?
There is definitely a need, which I think we've identified even as SANAC, to strengthen the social behavior change communications for HIV, TB, STIs, because, I mean, STIs also drive HIV infection. So it's an area that we are focusing on, because, as I said, even this message of you equals you needs to be driven by social behavior change. We are starting to see a decline in condom use, and the only way we can address that is by strengthening the social behavior change. So there is an active effort, and I think you'll be seeing quite soon areas coming up in terms of strengthening the communication, not just around HIV, but also TB, STIs, and overall prevention and health promotion.
Dr. Thembisile Xulu, thank you. Chief Executive Officer at the South African National AIDS Council. Really appreciate the time.